today we're going to be using wet cupping, which is a little bit different to the dry cupping which we've shown before. He suffers with an injury to the knee, which has caused some damage. He's had an MRI scan, it's shown some cartilage damage, and it's left him with a bit of swelling in and around the knee, and he's been having some pain. Just putting on a little bit of oil onto the knee now, just to help the cups attach properly. And then I'm going to apply 2 of the suction cups, which are just small cups that we use to create the negative pressure onto the surface of the skin. So these are single-use cups. When we use it for wet cupping, we only ever apply the cups on one person once. Okay, so we create that negative pressure, and what this does is just draws some of the any inflammation up to the surface and away from the inside of the joint. How's that feel, Jeff?
It feels great, no pain at all.
Okay, so now I'm going to go to the next step of the procedure, which is taking the cups off and applying some small little scratches into the surface of the skin. You can see some tiny little marks here where we've done the treatment previously. We treated the same area last week. We're going to put some very tiny scratches into the surface of the skin now using a very small blade. Okay, so I'm just going to nip the surface of the skin. Okay, how does that feel?
No problems at all, no pain.
Okay. Tiny little scratches. Okay, and you can see that they're just a tiny little nips. Okay, and now I'm going to apply this suction cup. Okay, and all that does now is the inflammation that's being drawn to the surface of the skin is now being drawn out through these tiny little scratches that we've put in to the surface of the skin, and it allows that pressure and that inflammation to be released. So any of the inflammatory modulators that are stagnant around that area, any pressure which is in the tissue, now gets released, which usually gives a little bit of relief in pain and symptoms, and also gives you usually a bit of an increase in range of motion as well, because the swelling itself sometimes stops the joint from moving as well. And we're just going to do the same now on the opposite side. Okay, I'm going to reapply the cup. Okay, so we'll just let that be for a while. How's that feeling?
There hasn't been any pain at all, certainly a lot less painful than not having it treated. It's almost like having a cut on when you shave. There is no pain. It's quite a carcinogenic experience watching it being done, but it's certainly not painful at all.
Okay, so we've had these cups on now for a good couple of minutes. We've just left the suction apply onto those tiny little cuts, and slowly, drop by drop, small amounts of blood now have collected into the cup, and we've got a little bit of an amount now in this cup. The quantity we take when we use wet cupping is usually quite minimal. It's usually not more than anything you'd have with a usual blood test. So there's no risks of having anemia or any serious side effects or anything like that from this. But now we're going to pop these off. Okay, so as I take this off, I'm going to try not to make a mess. Okay, I'm going to take the suction away. Okay, and I'm just going to tip the cup, and this is the consistency of the blood which comes out. And you can see it's a little bit thicker than what you would normally expect, and that's just because it's higher in proteins. When you have the process of inflammation going on, you have lots of different chemicals that get released in the blood, and especially if the blood's been quite stagnant, then it tends to be saturated with proteins and dead cells and different debris, and this is just what makes the blood slightly thicker. Okay, so we're removing the second cup now. Okay, and same thing again, take the suction off, And I'm just going to tip the cup. Okay, and again you can see the blood is quite gelatinous. I don't think this is what you would normally experience if you were to take a blood test or when you're giving blood. The blood doesn't kind of gel up this quickly. So like I said, usually when there's inflammation in and around an area, you'll find that the blood kind of gels up a little bit quicker like this, just as a result of the higher content of the proteins in the blood. Okay, and the bleeding stops pretty much straight away. So you can see from what we've done here, tiny little scratches on the surface of the skin, pretty harmless. Okay, and the same on this side. The bleeding pretty much stops straight away. As you can see, there's nothing coming out from that area. Those tiny little cuts or tiny little scratches have healed up pretty much straight away, and that's it.
When I had it done on the knee, unlike on my shoulders, I was able to watch it being done, and it was quite an interesting experience seeing some blood come out of my knee. But it was almost instantaneous. It was light on, light off. It sort of reduced the swelling instantaneously, and the improvement was immediate. I've read that there can be a few minor side effects, itching and what have you, but I've had nothing. Literally no side effects whatsoever, just almost immediate pain relief.